All right, you all. So welcome to another episode of Healthy Chats. And I'm your girl, Carleeka Basnight-Menendez. Yes, all of that. I know it's long, but it's okay. Connect with me on social media. Just start typing in Carleeka and it will populate. And on today, we have an amazing guest, Miss Selena. She is the CEO of WomenHeart. And so we're talking about heart health on today and the impact that she's making in the world. You all, I don't know about you all, but I think sometimes we neglect our heart health with stress and the foods we eat and just not having the education. And unfortunately, a lot of times we don't typically go to a cardiologist or anything until something is wrong. So Selena, welcome. I want to say thank you for taking time out of your busy schedule, impacting lives, sharing all around the world, just to join us on Healthy Chat. So introduce yourself.
Thank you so much. What an honor to be with you today for this conversation. Well, as you said, I'm Selena Gore. I'm the CEO at WomenHeart, and I have been in the role for 6 years. So as you can imagine, it's been quite a roller coaster ride since 2019 coming into the role. But also thinking about heart disease in the context of the pandemic and the context of all of the, let's just call it uncertainty in the world as it is today. And, you know, as women, we often put ourselves last, and that includes our heart health. But as you rightly said, we really need to reconsider putting our heart health at the very front of our health agenda, because we want to be around for a long time to take care of all the people that we love and all the people that depend on us. And heart health, I would argue, needs to be at the top of that list.
Absolutely. And I agree with you. So tell people, what made you, I'm a backstory person. There's always a reason that has pushed us to advocate and educate and empower people in search. So for myself, I advocate a lot in the menopausal health space, right? Simply because I had a total hysterectomy at the age of 30, and I couldn't find anyone to talk to. I couldn't find any resources. And so it made me say, you know what? Is this my lane? And now the more and more that you get into it, and I've been advocating for years as I'm doing research, but literally since 2020 when we held our first menopause and mimosa event virtually. And I was like, oh, there is really a need. And so I agree with heart health. So what made you say, you know what, this is the space that I need to really empower and educate?
Yeah, it's a great question, Carleeka. Now let's come back to menopause, because I do want to make some connection between menopause and heart health. But just to start, so when I was 18 years old, I lost my mom to colon cancer. My mom was 39 years old. And my two sisters and I think, without even speaking about it, decided to commit our lives to helping other families not have loss at such an early sort of, premature state in our family's life. And if fast forward to 2018, I was living in London. I was running an organization called the Global Alliance for Chronic Diseases. And through that experience, learned that heart disease was the #1 killer around the world of both men and women. And so when WomenHeart came calling, they recruited me into this role. And I thought, you know what, the stars are aligning here, because I want to make the biggest impact I possibly can while I'm still on this earth. And then in 2023, Carleeka, I got my own heart disease diagnosis. And so it was a really huge kind of eye-opener and turning point in my career, because I all of a sudden was more effective in my job, because I myself had gone through the exact same story and the exact same process that so many of the women that we help and we support through the course of WomenHeart's 26-year history. I was exactly one of those women. And so the passion and the commitment that I have to this cause and to this work just doubled or tripled from 2023 on. And it was on my birthday, actually. So there was some real alignment there.
Wow. And that's why I said I think backstories are so important. And it's always good to just hear what is pushing, what is driving for a cause such as that. And I agree, because I know so many people, it's so scary to think that, okay, is my heart functioning to the full capacity? Do I have anything blocked? And you may go to your physical appointment, right, and get an EKG done, but they have not. I know for my doctor's office, we have not always did an EKG. This has been over the last few years that they've actually added that to our yearly physical. And we know so much in our bodies can change
Yes.
within the year. So I remember my first time even going, being referred to a cardiologist. It was scary. It was so scary. But it was after I had COVID.
Mm-hmm.
Right. And so we were trying to figure out some things, and then having the echocardiogram. And though my background is in science, so to me, it was kind of cool to see your heart, but it was still very scary. And so how do you give that approach and information for people to say, hey, it's okay, right?
Yeah. Carleeka, the way I think about it is the way I think about a mammogram, right? Like we are all as women, we're all very used to getting our mammograms on a regular basis. Mm-hmm. And as painful as that process is, we all do it. And the rates of folks getting mammograms is quite good. And that way we're able to detect breast cancer much earlier in many women. I want folks to think about heart disease in the same way. You want to get checked out. The statistic is that 50% of people who have heart attacks die from that heart attack. You want to be part of the other 50%, right? So there's another 50% of us who survive it. And the way that we do that is to be aware of not just the symptoms, but the risk factors even before the symptoms, and to also really know your body. I think, this is really important. One of the things we know is that women are more likely than men to be misdiagnosed or have delays in diagnosis, especially in the ER setting. And what I want to tell women in particular is know your body so that you know when that thing that you're feeling is out of the ordinary. Right. So when it's a pain, or when it's a pressure, or when it's a feeling in your body that you never felt before, that is worth seeking some care. And don't let them send you away until you get the proper diagnosis.
And I love that, because a lot of times we feel something and we're like, oh, I just feel a little off, or I felt the pain, but you know what? I have to go to work. I have to get the kids taken care of. I have a business to handle. And we sometimes push those things to the back burner until something more drastic is happening. And so I love what you said, just really being proactive and knowing your body is so vital.
Absolutely. I cannot stress that enough. We've heard many stories at WomenHeart of women saying, you know what, Selena, I was in the middle of having a heart attack and I just didn't have time to go to the ER for all the reasons that you just said. Right. For all the reasons. I needed to get dinner on the table. I needed to get my son to soccer practice. I needed to fill in the blank, right? We all have that thing. And every time I'm on an airplane and we're getting ready to take off and you hear that announcement of, put your mask on before you are able to help others, I like to remind women that we have to listen to that for ourselves. If we are not taking care of ourselves, we are not going to be around to be able to take care of those around us that we love and we want to be there for. So it's really, really vital. Listen to your body. Go to get the help that you deserve and that you need in a timely fashion. And I have a very dear friend who's a cardiologist, and she says, Selena, would you rather be embarrassed that it was nothing, or not around anymore?
Right.
And that is a really important
That's powerful.
question that folks need to ask themselves.
That is powerful. That is powerful. So, can you provide, because some listeners may not even know, what are some signs? What am I looking for, right? Because I don't think, even when you're in school, right, you have a chapter on the cardiovascular system, right? But
Right.
even then, what signs should people look for? What are some that education that we can even, I believe things start at the kitchen table, right?
Yeah.
Having these conversations, not just as an adult, but so that your children and different ones, because there we've heard stories and seen, and some of us have even experienced things where it was someone's child that they're like, this is my hero. They knew the signs, or they knew who to call. And so what are some of those signs that people should definitely look out for?
So the number one symptom, Carleeka, of a heart attack for both men and women still continues to be chest pain or chest pressure. Okay, so for sure, especially if it's out of the ordinary, you've never felt it before, and you've got that chest pain or chest pressure, especially if you feel it on exertion. In other words, you are walking fast, or you've come up a flight of stairs, or you've brought something heavy inside to the house from the car, and you feel all of a sudden, chest pressure or chest pain. That is something that needs to be looked at by a healthcare provider immediately. Number two, for some women, they have other symptoms like nausea, vomiting that has no other explanation, a fatigue like you've never felt before, pain in the back or the jaw or the neck, or the arm, right? These are all, I don't want to call them uncommon, but they are symptoms that show up more often in women. And we often show up to the ER and say, it wasn't a chest pain. It was a little bit of a, where the bra strap, hits my chest. So I want folks to get comfortable with the idea that if there is pain in your chest, call it chest pain, because that will be the clearest way to communicate to the healthcare provider that they need to do a check on your heart.
Wow, that is right. I didn't even think of like the neck pain or anything, but that is, wow. That's why I was like, well, let's add this too. And so once someone may even know the signs and different things, even if someone has a heart attack or heart surgery and different things, what does that look? Well, let's say this. What are some proactive ways, right, that we can really take care of our heart health? What are some proactive ways?
I love this question because while heart disease is scary, we know that 80% of it is under our control. So 20% of heart disease is determined by our genetics. So the first thing I say is talk to your family, talk to your parents about heart disease in the family, so that you have a good understanding for what your genetic history is, or your family history is. The second thing is, like, the big things to focus on are eating healthy. So eating healthy, lean proteins, eating lots of fruits and vegetables, and minimizing your intake of sugar or processed foods, and like big carbs, and exercising. And, exercising doesn't have to be joining a fancy, expensive gym. It can simply be getting outside and taking a walk. Even in the hot days, one of my favorite women that we work with, Judy, in the hot days, she can do like 10 miles in her house because she just moves her body, right? So it's all about the movement. When you're walking up and down stairs and doing laundry or cleaning the house, that all counts because you're active and you're moving, you're taking things from one place to another. That's really important. The big thing I would say that I think people underestimate is the power of good sleep. That's really, really important. This is something I'm working on this year, Carleeka, is to get better at sleep, to have a set routine, to get at least 7 to 9 hours of sleep a night as an adult. Have a same bedtime and a same wake up time every day. These are all really good tips for a good sleep hygiene. And then stress. I mean, I think to tell a woman to avoid stress is not realistic.
Right.
Right. So what I'd rather do is tell women to figure out the ways that you can manage that stress.
Absolutely.
Whether that is, taking a moment and taking a deep breath, or, 2 or 3 minutes in the morning for some deep breathing, or some prayer, or some meditation, or some journaling, a way so that you have an outlet for all of the weight that you carry, not just for yourself, but for your family and for your community. I think that's really, really important. And it's something that can go a long way. The last thing I'll just add, Carleeka, is I mentioned earlier about menopause and heart disease.
Yes.
Women who are perimenopausal or have gone through menopause have a now higher risk for heart disease, because estrogen that has now gone away is cardioprotective. It improves our cardiovascular health. So now that the estrogen is no longer there, the risk of heart disease for women goes up. So if you haven't had a heart check by the time you've gone through menopause, please, I urge you to do so. See your primary care internal medicine doc, and they may refer you to a cardiologist.
I love that, because a lot of times, even with menopause and different things, you hear hot flashes, night sweats, and different things. And not a lot of people just don't realize that menopause affects every bodily system, right? It's not just the hormonal side. It's like that. Those hormones are all through and affecting every bodily system. I want to say to you, congratulations on working on better sleep habits and really sleeping well. I am definitely a proponent that I believe in getting good sleep. So I have my own nighttime. Like, I typically by 10 o'clock, everything is shut down. I wind down all of the things, because I do believe in, and menopause women are like, oh, the night sweats. Not. I'm like, look, there is a solution for every problem. My husband might be covered up like a little burrito. We're gonna have that tornado fan on, and things like, you got to find what's going to work for you. And so I say congratulations to that, because a lot of times we have normalized not sleeping well, right? We have normalized like, oh, I function with 4 hours of sleep, and your body's like, but I'm not fully functioning to the full. Like, respect your organs.
Yes.
And your cells, right? Feed them well, and that sleep health as well. But that's some of the conversations that are so needed, because a lot of times we weren't really taught those things, whether it was culturally, whether it was just within your household. Like, parents set a bedtime, and then when we get older, we're like, oh my God, do you know what I would do for a nap?
Exactly. We don't want to sleep when we're little, and we want to sleep as much as possible when we're older.
Right. And it's like, let's just find that balance and just develop healthy sleeping habits. And so, Selena, before we leave, is there anything that you have coming up? How can people connect with you? And any last words of encouragement and empowerment?
Yeah, I encourage folks to go to WomenHeart.org. Also, we are always looking for women with heart disease who might want to give back to their communities. And we train women to become Women Heart champions. We work with the Mayo Clinic in Rochester, Minnesota, to develop and to implement this fantastic training that puts you in a good place to go back into your community and serve as a peer educator and an advocate. We bring advocates here to Washington, D.C. To go and lobby to our Congress people and senators for policies that are heart healthy for women. The last thing I'll say, Carleeka, is take control of your health. This is your body. You know it the best. And don't take no for an answer if you know that something is really, really wrong.
I love that, you all. And so, look, you all, I'm sure you'll see Selena again, because this conversation was so rich and it is so needed, especially in all communities. But I do know, even for women of color and cultures, you all, we need more of this education and information. And so this is why you have people, we're out here doing what we do. And I love what Selena said. She said, you take control of your health. You're in control of it. Don't take no for an answer. If you need another doctor, find another one, right?
That's
If you
right.
don't feel heard, you don't feel like they're listening, you don't feel like whatever that is, find something else. But we can't make excuses for not living healthy, healed, whole life. And so look, your health journey is your priority. And this year, make it a priority. We're almost in month 6, okay?
Where did it go? Where did it go?
Half of the year. And so this is the impact that Selena is making, and the impact she's given about your heart health is that impact that could either kill you or cause you to live even healthier. So make sure you all connect on the website, and you all will definitely get those links. And if you know a woman, right, spread the word. If you can't do anything else, share this podcast, share this show so that we can rise and energize each other together. And this is another episode of Healthy Chats. We will talk to you soon. Have a healthy heart and a healthy day. Take care.